I got this question. What's my advice in helping you as an occupational therapist get into hand therapy without a clinical rotation in hands? Hey there, it's Huang Tran. I'm an occupational therapist and certified hand therapist, and my job here is to help OTs develop their clinical skills or business skills so they can have more choices in their career. So I get this question a lot. If you want to get into hands, but you don't have a clinical rotation in hand therapy, it's okay. It's still totally possible for you to get into hand therapy. Now, if it's been a long time and you want to get back into hand therapy or want to get into hand therapy for the first time, even without a clinical rotation, it is still possible. Believe it or not, there are billions of people on this earth, and there's a very small fraction of occupational therapists and even a smaller smidgen of certified hand therapists. If you want to get into hand therapy and then that will then lead you eventually to become a certified hand therapist, if that's what you want, just know it's possible. But here's the number one thing that you could do to help yourself. And the only thing that you want to focus on is actually, how do I make myself desirable, right? How do I make myself so desired by this other company to hire me, even if I don't have a ton of hand therapy skills, right? You have to make yourself desirable by a company to be hired. Now, I have helped inside the mentorship program OTs who have worked in peds, OTs who have worked in skilled nursing, OT who's have worked in home health or acute, whatever setting it is. I have helped them get into hand therapy no matter the years, no matter the clinical rotation. But the one thing that I always tell them, and they do this, is by making them desirable to be hired, right? To be hired. And how do you do that, Huang? How do I become desirable to someone so that they will hire me? Well, if you think about it, let's break this down. You want them to pay you a salary, right? You want money. Now, what do they get in return for giving you money every 2 weeks? You have to do something, and showing up and with a degree doesn't really cut it anymore, right? You actually have to come in and say, I will treat X patient for you, right? They only get paid so that they can pay you when you bill your time and provide treatment. It's that simple. It's that cut and dry. So if you graduated from OT school, you are technically saying, I know how to evaluate, I know how to treat, and I know how to discharge, right? Document all that stuff, right? I know how to evaluate, I know how to treat, and I know how to discharge. Those are the three main things that OTs do, right? And so you have to come into there and say, I know how to evaluate. Now, you have to take baby steps. Sometimes going from whatever peds position or whatever skilled nursing position, you have to use what you already know and do and have done to then apply it to what hand therapy requires. If it's evaluating, you know how to evaluate. Now you just have to learn the specific types of evaluations that you would need to use in that scenario. Then you would need to, how to treat, right? You know how to break down a problem and say, okay, if this is the symptom, this is if this is a symptom and we are going from symptom to solution, then what's all the in between that I'm going to do? So you have to learn that. So you're going to need to take some courses, right? If you don't even know carpal tunnel, you don't know distal radius, you don't know tennis elbow, like if you don't know any of that, and those are just generic ones, how can you go to a job and say, I know how to help those people, right? You have to learn new skills. Your foundational skills of evaluations, of generic treatments are there. You know how to discharge, you know how to document, you know how to bill. These are all desirable skills, but then you got to get technical to the hand therapy ones, right? Don't jump to Don't jump to flexor tendons. Don't jump to splinting. Don't jump to wound care. You can learn basic stuff first. You can learn basic orthopedics. You can learn basic manual therapy skills, and then you compound that with wound care, with splinting, and things like that. And what you need to do is think about what jobs you need that are available. If you're coming from peds and you're applying to that high pace, fast paced doctor surgeon office, you might die, right? Because what's a surgeon do? They do tons of surgery. And so what are you going to have to do? You're going to have to provide tons of therapy to post-surgical cases. And if you have no experience, it's going to be very fearful, very intimidating, and you might not get the job. And oh shit, what if you do get the job? What are you going to do now? Right? So it's just whatever your tolerance is. Can you take it? Can you deal with it? It might feel really bad at first, but what happens that I usually tell people is take a class, take a course, join a mentorship program. I've got so many things available in my like the courses that I provide. So if you're just starting out and you're so far removed from hand therapy, do foundations. What I find is sometimes they oh, I erased it. They want to become you want to become a certified hand therapist, but you're forgetting all the steps. So if your ladder is huge, or here, you're here, right? And here's a CHT goal, right? And you want to go from here to here, it's near impossible. But if this is your goal, right, and you have steps, then you as this person here can take one step at a time, one step at a time, one step at a time, right? That makes it easier. That makes it more doable. I've had people come from don't have the hours, don't have the years. They're frustrated with their pediatric job. And so they call me up, they're like, Huang, I want to become a certified hand therapist. Can I join your exam prep program? It's a $3,000 program. Can you join it? Sure you can, but are you a candidate for it? No. I mean, if you want to give me your money, I'll take your money, but let's set expectations because you're here, you're going to need more time. You're not going to pass the CHT, right? So I could sell it to you, but then you're not going to be successful, which hurts my heart, right? But also, you're not going to want to pay for a program you can't be successful in, right? So we got to build steps for you. So if you have no hand therapy experience, get foundations of hand therapy, right? Get foundations of hand therapy. This is a basic program. It goes over basic anatomy, basic diagnosis, using some of the frameworks that I teach, evaluations, clinical testing for some general diagnosis in hand therapy. What's it like? Documentation, treatment. There's some basic in there. It's a lifetime access course, but it gives you a small taste, a little bite, right, of hand therapy. And if that ignites you and you're like, yes, I'm going to put my resume together, I'm going to start setting it out, I'm going to get that job, right? Then you can go into the mentorship program. Right? So some people come into the mentorship program before they get that job because they're like, I'm trying to get the job. Keep getting turned down because I don't have the clinical experience. I'm like, well, you're getting calls. You're coming in for an interview. That's good. Then you need to learn certain things so you can know how to say things so you sound intelligent, so you sound like you know what you're talking about, and that you're just looking for a place to develop your experience, right? Some people don't even get calls. I'm sending my resume out and nobody's calling me back. Well, then the problem starts at your resume. You got a shitty resume that doesn't explain to people who you are, and that you could do the job. So then they come into the mentorship program, and then I help them fix their resume, start sending it out. And then at the same time, they're learning so that when they do get the call, they can get the job, right? Some people come into the mentorship program when they already have the job, but they're sick and tired of being alone. They're sick and tired of learning on their own. They're sick and tired of not knowing what they're doing, right? Not knowing what you're doing really is so hurtful to you, like your self-esteem, your confidence, um, and it makes your job less enjoyable. So when you know you're on the right track and you have someone that you can discuss things with in a safe environment, in a safe way, it helps. Mentorship helps, right? And so they joined that program, and I have CHTs in that program. I've become a CHT, but I've only worked alone. I don't have anyone to really bounce off of. I want to feel safe in an environment where I can ask questions and not be judged. That's a huge one, right? So they come into the mentorship, they keep learning. So the mentorship is a place to learn, it's a place to develop, it's a place to grow, right? And then when you're ready, let's go and become a CHT, right? Let's go and become a CHT. Let's go and study for it. Now, I've got two programs there. It's the exam live version and the exam on demand, right? So depending on where you are in your journey, they both can help you. But that's the, in a way, that's a step-by-step process to getting into hand therapy without clinical rotation in hand therapy. It's extremely difficult. I'm sure somebody's going to be like, Huang, I did it. I went from nothing to everything. I understand that that can happen. It also happens to a very small percentage of people. But I think there's a bigger percentage of people who are thinking that they can go from here to here, and it's so hard that you will lose your motivation, your discipline, your desire to become a CHC because you're going to think it's so hard. It's only so hard because you haven't taken the necessary steps, right? That's my advice. So have the goal in the back of your mind, but then take the necessary steps to build yourself, build your resume, build your clinical experience, and make yourself more desirable for a company to look at you and say, yes, I want to hire this person. The people who are inside my mentorship, they come in, they learn, they fix their resume, they start putting their resume out. And I can tell you right now that having my company CEUs or having my company certificates, uh, demonstrating to an employer that you're willing to invest in yourself to develop your clinical skills, that is a sign that you um, are willing to invest in yourself before other people are willing to invest in you. And that is a desirable trait. When I am looking to hire somebody, I'm an employer now in my clinic. Inside my programs, just hired an OT to help me teach inside the program. I hired an OT, in my clinic. I'm getting ready to hire another OT in my clinic. I am looking for someone who's desirable. I am looking for someone who is willing to invest in their own learning. And when I see that they're invested in their own learning because they already started that, I want to hire you and I will further invest in you, right? I don't want to invest in someone who has not shown me that they're willing to invest in themselves. I don't want to hire somebody who has no desire to learn. I don't want to hire somebody if they're like, well, I only took that class because they told me I had to, so that's why I did it. That's your CEUs. That's a basic requirement. I don't want basic, right? I want someone who is, man, they just want to be the best. They want to learn. They want to grow. They want to provide the best therapy services. They want to have outcomes, for their patients that's what I want too. Imagine you go to a therapist yourself and they're like, yeah, I did the basic, like the minimum. I don't know what's wrong with you. Why don't you go back to your doctor? I don't want that in my clinic. I wouldn't want that for myself. And I've gotten hurt many times. And, I want someone who gives a shit, right? Really, at the end of the day, I want someone who gives a shit. And because they give a shit, I give a shit. And I'm like, you know what? I want to invest in you more. If you don't care to invest in yourself, you don't care to learn, who is going to make you learn? And I think that is some of the biggest foundational conversations that we should be having as OTs, not what you are entitled to, right? It's what you show that you attract of what you want. It's just the same idea as like you want someone that you don't want them to just say I love you. You want them to show you they love you. You know what I'm saying? So to sit here and be like, well, I'm not gonna show you that I love you until you show me you love me first. Like, I don't know. I don't know about that. So that is ultimately my advice if you want to get into hand therapy. Become desirable, become so desirable, right, that you are having to turn people away. You get your top pick, you get to pick where you work, you know, be that desirable, right? Be that desirable and make it easier for yourself. Build those steps, take the little steps versus trying to hurdle your way into becoming a CHT. Right. All right. Let me know if that helps you. Leave me a comment below. I'll include the links to my programs down below, but I'm always open to answering your questions. You shoot me an email, info@handtherapysecrets, and I will help you make a decision on which programs could be best for you based on where you are in your journey. I get people who send me questions all the time, especially when it comes to studying for the exam, what helps them where they're at, their situation, because that can help determine which program it would be good for you to get started with, right? I have turned people away. I'm not saying it just to say it, but I have turned people away who are not candidates to be in the exam prep program. It's an expensive program. I'm very considerate of your hard-earned money, your time, your efforts, and I want to make sure that you get into the right program that's actually going to help you. Now, you can't just buy into a program and be like, it helps me. You know, you have to actually do something about it. But my goal is to help you. My goal is to help set you up for success, right? Because if you're successful, then my program is successful. So, I want to make sure I do right by the OT community. So, if you have questions about it, you can leave me a comment below, but you can certainly, send me an email. I'm happy to answer. Okay. So all the resources are going to be below, and I will see you next time. Peace out.